Everybody, I think we've still got people filtering through, but we've also got an action-packed agenda, so I'll start and get going. So it's really good to see so many people here celebrating. Hi Kirsty, it's great to have some people who used to work on Ambition for Aging here, and John as well, who chaired the committee for years. So today we're going to be joined by all of our partners, including the Older People's Network, who we have co-designed this event with. And we'll also, the Older People's Network will be launching one of their new campaigns. And there'll be a short break in the middle as well. So just moving on to housekeeping. So if you do feel comfortable, it would be great if you could add your pronouns to your Zoom name. And if you are from an organisation, to put your organisation on, just so that we can refer to each other accurately. We're recording today's event, so you know, if you can leave your video on, great. If you know, if you do want to turn it off, then fine. But it is really good as a speaker to be able to see people, see the people that you're talking to. So if you can, that'd be fantastic, especially in the breakout rooms. And if you can keep yourself muted until the end of the event, there will be an opportunity for discussions in breakout rooms. If you've got any questions, put them in the chat, say hi. A lot of people already making comments in the chat. Yeah, if we do get time to answer any questions, then we will. Right, okay. So just moving on, just onto the next slide, Mary. Now we've done housekeeping. So today we're here to highlight the learning from Ambition for Aging from over the years. And that's been, you know, trying to choose which learning has been quite an enormous task, because there's been so much learning through Ambition for Aging. So today we're going to be focusing on learning around co-production, but that will be shown through the work of the Older People's Network, which was a fully co-produced network. We'll be looking at the work on equalities, the importance of social infrastructure and our approach to microfunding, and how changes to a small place can create more age-friendly places. So really good to see everybody saying hello in the chat still, keep that going. So Ambition for Aging was a National Lottery Community Fund strategic programme funded by, called Aging Better. And there was £87 million invested in 14 different partnerships. And it's aimed at understanding how to reduce loneliness and social isolation in people aged 50 and over. So the bid was worked on, with, you know, we're looking at 7 years now, but the bid was worked on a long time before that, with lots of different partners from local authorities, VCSE organisations, the Combined Authority, and university and older people themselves. Worked on developing that that proposal, and we were really lucky to get the funding with the name partners, who were the GMCA, so the Aging Hub, LGBT Foundation, MAC, who hosted the Older People's Network, and also MICRA, which is the Manchester Institute for Collaborative Research on Aging at the University of Manchester. So Ambition for Aging was a test and learn approach, so really looking at what works, and also what's really important as well, what doesn't work. And it's a very different way of working. You know, personally myself, I've worked on projects before where you go to a project and there are set milestones, there's outcomes, it's a set way of working, whereas with Ambition for Aging, it really was feeding that learning. With it being a 7-year programme, there was time to feed the learning in and change, and that can be challenging at times, because people are challenged to work in different ways and develop different approaches along the way. So, and I think some of the delivery staff found that you know, it had a huge impact on their approach to working with older people, and that they really learned from working on the programme. It was a place-based programme, so that's from the ethos that it's not the people that need to change, but it's the place. So you know, what changes can we make to a specific neighbourhood, in order for older people to for it to be seen as an age-friendly place. So it's a person-centred approach. Another element was, you know, really important for things to be co-produced and co-designed. So working with older people, having their voice and at the heart of decision making and at the heart of the design of Ambition for Ageing. So older people knowing what is needed in their communities to make them feel safe, to make them feel connected, and empowering them and valuing their voices so that they became confident and able to make connections. And this was how the partnership worked too as well. So the partners getting together at each turn to decide how the programme progressed, and with the partners feeding older people's voice into that process too. So we worked with an analyst based at GMCA at the Ageing Hub, and that was really important for them to be looking at that data and evaluating that information with older people, looking at what is it that specifically older people in Greater Manchester need for it to become an age-friendly place, and how can we influence service design and commissioning. We work with different researchers at Micra, so not only bringing in academic research into Ambition for Ageing through a series of seminars, and translating that theory for older people and also for people who working with older people so they could feed that into their practice, but also bringing their different skills into the research. And we've got Dr. Luciana Lang and Dr. Sophie Yarker later presenting some of that research. We work with LGBT Foundation at the Equalities Board. So that was a group of people with lived experience of inequalities, and also organisations who work with them, acknowledging that, you know, very early on, inequalities drive social isolation, and how important it is to have equalities as at the heart of a project and not added on at the end, and that equalities needs to be approached in different ways, with targeted work and work that's more open to all. And then with MAC, with the Greater Manchester Older People's Network, so you know that network has developed and grown over the years. There's a formidable group of older people, a web across Greater Manchester, and they've worked on many different campaigns, and like I said, we'll be launching one of their campaigns today. So now I'm going to hand over to my colleague Ellie, who will be talking about some of our age-friendly work.
Thanks, Thea. Mary, can you bring up the slides, please? So yeah, as Thea said, I'm going to give you a bit of a whistle-stop tour on what Ambition for Ageing has done in terms of delivery, trying to put some of those values and those aims into practice.
Can you move on to the next slide, please, Mary?
Right, so I'll start with while the slides are coming up, I'll start with just a bit of an overview about what we did. So for the first 5 years of the programme, we were trying to, well, throughout the programme, we tried to make age-friendly places by having a lot of small changes within neighbourhoods to try and make a big difference and help build those connections. So in the first 5 years, we had local delivery leads. So that was one lead organisation in each of the delivery areas, and they were focusing on a few neighbourhoods within that borough. So across Greater Manchester, that was 25 different neighbourhoods that we were trying to make more age-friendly through micro-funding. So that was funding small activities and changes such as like benches. And then the years 3 to 4, we started to introduce some scale programmes. So these were 11 larger programmes that were across Greater Manchester and were aimed at reaching a larger number of people as well. Then the last couple of years, we've had Support and Ageing in Place, which again has been another micro-funding project across 20 Greater Manchester neighbourhoods. And that funding's been distributed centrally from GMCVO. And then we also have had Ageing Equally Dispersed Communities project as well. So back a slide, back. Okay, yeah, local delivery leads, next one. Sorry, thank you. Right, so the a bit more about what the local delivery leads did. So they all work to build on the existing assets in those areas, so the organisation spaces, but recognising that one of the most important assets in those areas were the older people that lived there. So all the local delivery leads approaches varied somewhat, but older people were always at the heart of their design, and they helped drive where investment was needed, and sort of took a lead on that. So with the idea that older people in those areas would know what is needed specifically in that area for those residents that live there, rather than something that was more broad. So it might be that people know where, someone might know where a bench is needed, so having it in the right place, for example. But the what was sort of found was that for effective co-production, it's not as easy as just inviting people into a room and saying what's needed and then funding that. There was a lot of time and resource that was committed by the local delivery leads, the Older People's Network, and the Equalities Board as well, that have managed to, over those sort of 5 years, well, 7 years now, created a sort of a more diverse range of participation within the project, and given more people the confidence to actually participate and get involved in the programme, which in turn has then meant that we're able to increase social connections for, you know, a broader range of people, and prevent isolation more widely across those neighbourhoods. For this though, in line with the test and learn approach, they've had to be very flexible in their delivery and adapting things to be more inclusive. And one thing that we were fortunate to have in this programme was having time to be able to do that. So the local delivery leads were working sort of probably about 4 years by the time they were funded. So they had some time to reflect on who was involved in the programme and where those gaps were as well, and do some targeted work around that and how they can reach those people, reach those communities, and get funding to the places where it was needed and where it was missing. And even after those 4 years, the funding still didn't reach everyone within those areas. So it just shows how much time and investment is needed to do it effectively. Having a sort of a broader range of people involved in projects and activities, one of the things that came up was that people within those areas could recognise there was more people like me. So they were recognising that someone that they may have seen as different to themselves, that there's similarities between them. And in turn, the programme was able to sort of facilitate some of those relationships, and increase sort of a sense of belonging for people within those areas, knowing that everyone within that area has got similarities. The local delivery leads we could see the value in having sort of local organisations and communities leading on where the investment and funding was going in those areas, and they could build on their sort of existing local relationships, like with the local government, health services, for example, but then also building and creating new networks and relationships through the micro funding. So with those smaller groups and smaller organisations then getting involved with sort of the bigger charities. And then those are sort of networks that are going to last beyond the lifetime of the programme. Next slide, please. So then we moved on to the scale programmes. So we funded 11 scale programmes, which were all quite different. As I mentioned before, these were large pots of money, not neighbourhood specific. So some examples, some of you might have been aware of or might have been involved in. There was a Festival of Ageing, social eating. We had 3 community media projects. We had age and equal equalities research. We had a employment support programme for carers, which was called Working Potential. And then Gold, which was growing older with learning disabilities. There was a few more as well beyond that. So some of them were just focused on research, some were delivery, some were a mix of both, but the learning from all of them went towards the programme's overall learning. All the scale programmes, sort of in line with everything else on Ambition for Ageing, were co-designed and developed with older people. So that was also with the Older People's Network and with the Equalities Board. So it began with a consultation event where people could bring their ideas of good project ideas for the scale programmes. We also looked at what had worked in the local delivery leads funding and see if there's anything there that could be replicated, and looking at gaps where investment might be needed across bigger areas. So with the the co-design being some of the learning that we brought into that. We also had a lot of involvement from the Equalities Board in designing and the decision making in who delivered the scale programmes, and they also provided training for all the organisations that delivered them to try and ensure that these projects were as inclusive as they could be, reach a broader range of people. We adapted sort of the commissioning processes. So one example was like the Age and Equally research project. We had a two-stage process to try and support smaller grassroots groups that could reach different communities for the research, who would be best placed to deliver it, just in making it more accessible and enabling them to access the funding, and provided outside support for them to develop that proposal and develop the skills. Next slide, please. So this is just a quick example of one of the scale programmes, so Working Potential. I quite like this quote here because it sums up how a lot of the carers that were on the programme had felt, whereas they'd lost their identity. And through taking part in Working Potential, which was all for carers, it was people were able to find themselves again and able to connect with other people, and were no longer just a carer. And it was through small things like this walking group here in Bolton, and just having that time for themselves and to be able to connect with other people again, rather than just being that person's carer. Next slide, please. And then finally, in the last couple of years, so at the end of year 5, when we should have been celebrating and starting to disseminate our learning, and it was the COVID pandemic struck. So we had to adapt and change how we were doing things. And this is when we started supporting aging in place. So in year 6, we had a pilot. And then over the last sort of 12 months, with delivery starting last summer, we were funding different groups to deliver small projects, another micro-funding one. So this was, we funded 89 groups to deliver 101 projects in the second half of last year. And I think the importance of this was enabling people to connect during the pandemic, also restarting services that had to stop, or people that had to make changes to the way they deliver, and being able to connect with social distancing in place. Again, we had like flexible and supportive commissioning processes, and MAC and the other local infrastructure organisations were there to offer support for people developing the bids. And as a result of that, we've funded 64 grassroots organisations within that last 6 months of last year to deliver these sort of projects and help make these 20 neighbourhoods for supporting aging in place that little bit more age friendly. So that's my quick summary of how we have sort of delivered these things through Ambition for Ageing.
Thank you, Ellie. I think it's no mean feat trying to fit everything into 5-6 minutes, so well done there. So now we've just got a short video that features some co-researchers from one of the scale programmes and colleagues who've worked on it, just talking about the impact of Ambition for Ageing.
Hi, I'm Yasmin Holgeth. I'm an age-friendly neighbourhood health worker for Buzz Manchester Health and Wellbeing Service, and we're part of Greater Manchester Mental Health Trust. In the Buzz service, the community is at the heart of everything that we do, and the Ambition for Ageing programme really echoes with those values. And the Ambition for Ageing programme has supported us with some of the One Small Thing investments, where we've worked with groups in Gorton to access these small pots of money to deliver projects. One of those projects was a sing-along on your doorstep, where residents on the West Gorton estate all came out of the houses the same day, the same time, and sang the same song. And it was all about creating an opportunity for the community to feel connected on their estate without people having to mix in an indoor venue. The Ambition for Ageing programme funded some maps for the age-friendly benches that ourselves, Buzz and Archon Housing provided in the Gorton and Abbey Hay area. The benches were designed by 2 local people, and they contained information about the benches and also all the different community centres that were along the route of where these benches were positioned. So the Ambition for Ageing programme has had an impact on us in several different ways. They've supported us with funding for different projects, which I mentioned before, but also the different toolkits that the Ambition for Ageing have provided have been useful resources for our team to use. For example, the Equalities Board produced a toolkit around looking at the equality demographics within neighbourhoods and how to reach out and deliver projects to more marginalised communities. And we, within Buzz Manchester Health and Wellbeing Service, found that a really useful tool. And also the Ambition for Ageing programme has done several different online seminars, and they've invited us to come with some of the residents we work with, such as the Human Moss Side Age Friendly Board, to come to some of these seminars and speak about what we're doing in communities. And this hasn't just provided an opportunity for us and residents to showcase what we do, but it's been an opportunity for us to be part of the Ambition for Ageing programme and what they deliver.
My name is Muaz, and I work as a research and advocacy officer at Rethink Rebuild Society, a charity organization for the Syrian community in Manchester. We were funded by Ambition for Ageing to conduct a research called Aging Equally, a case study for elderly Syrian refugees in Salford and Oldham. And the collective aim of this research was to understand how Salford and Oldham can be made a better place to live for elderly Syrian refugees. Clearly, conducting research with smaller communities like the Syrian community in Manchester has some benefits. I think the theme Aging Equally, as constructed by Ambition for Ageing, was interesting and eye-opening, because it was a reminder that we need to pay more attention to this category of refugees, elderly refugees, who are often overlooked in the narratives on refugees in general. It's also important to have a real impact. We know that we cannot do much at the macro level to change the situation of refugees all over the world, but maybe there is something achievable at the micro level to help people around us. We have refugees in Greater Manchester. What can we do within our capacity as an organization to improve their lives and to promote change locally and more broadly? And that's why we think that this project has been instrumental in this regard.
I'm Mel Chapman, Research Fellow at Manchester Metropolitan University. Ambition for Ageing wanted to find out whether older adults with learning disabilities were included in their local communities across Greater Manchester. So they funded us to set up a team of 15 older people with learning disabilities to do some research to find out whether people felt part of their local communities.
My name is John Hendrickson. I'm part of GM Gold.
I'm Shirley. I've been doing the research of GM Gold at Greater Manchester.
Research team members with learning disabilities did the interviews supported by research buddies.
For our research project, we went out and about seeing people who are over 50 but growing older, went round to see people what they like.
Going out places, filming, going to people's houses, talking to people, and I really enjoyed doing GM Gold with Mel and the others.
I was doing a voiceover for GM Gold, saying that people getting older and people with disabilities getting older in Greater Manchester.
Going on Zoom, doing arts and craft, talking. I just basically like doing and meeting people out in the community and talking about different things of what they like doing. Do they like having carers, support, but some of them like to do things themselves they want to be independent and doing things themselves and having support.
Our project was called GM Gold, Greater Manchester Growing Older with Learning Disabilities. And we looked at loneliness and social isolation amongst older adults with learning disabilities across Greater Manchester.
Great to hear from some of the people involved in Ambition for Ageing. So one of the relationships that's been really important with us from developing in the developing stage and all the way through, and is still incredibly important, is that one with the ageing hub at Greater Manchester Combined Authority. And when the pandemic started, they put in weekly ageing hub meetings, and it's been really good to be part of that. It's a place where people working in the ageing agenda can share and learn from each other, and being able to, you know, build some relationships with people from across Greater Manchester. So it's really good to have Paul McGarry here today, Assistant Director at Public Service Reform. Paul, if I could hand over to you, please.
Yeah, thanks,
Thank you.
Thea. Can you hear me okay?
Yes, we can hear you fine. Yeah, great.
Yeah, okay. Well, look, it's absolutely fantastic to be here, isn't it, together? It's just a shame we're not quite in the same building yet. But it's wonderful to see so many familiar names and faces. I wanted to say a few things about the programme and the work that's being done from my perspective, both from a personal perspective, but also from an organisational perspective. And for me, you know, I mean, it's been an incredible journey, an incredible amount of work done. But for me, the starting point was a meeting with the Big Lottery Fund. And I don't know when it was, but I'm thinking about a decade ago in the Beth Johnson Foundation offices in Stoke-on-Trent. And they came to meet a few of us who were involved in the kind of local government programs around ageing. I can't quite remember whether it was the age-friendly stuff at that point or not. And he came to talk to us about what, as local authorities, so at that point I worked for Manchester City Council, what as local authorities we wanted to see in terms of investment for the ageing agenda. And we said we wanted 2 or 3 things. One is that we wanted long-term funding rather than 2 or 3 years funding, which was typical at that point, certainly, for these types of things. So just as you were getting going, you had to plan your finish. Secondly, that they were place-based. So rather than just being project-based in a town or a city, they were actually about changing the places in which people live. And thirdly was that they were organised around older people's organisations, voluntary sector groups and others. And before we knew it, the lottery had come along and responded really positively. And what we got was the national programme, Ageing Better programme. Now, there's a slight detour in this story for me, because this was fantastic news, and we were told that local authorities could bid for up to £6 million, as it was then. And then one day, and I can remember the moment, one day I'm in Manchester Town Hall Extension, and we got the news that this was in the kind of early days of the GM world, that there was going to be a GM bid rather than, so there weren't going to be separate bids from the 10 local authorities. And I've got to say, I went berserk, because I'd done all this work, lined this bid up. Manchester, it was going to be a fantastic £6 million bid. And I got the email saying, I won't say who told me, Paul, right, you're going to have to work with the other 9 authorities, or however many it was, 7 authorities as it turned out. Not very soon afterwards, I was basically told, right, Paul, you've got to do the GM project rather than just the city council. And as things would turn out, that decision, which caused me a huge amount of anguish and anxiety, was a brilliant decision for us in GM. And in many ways, the programme became, the Ambition for Ageing programme became, if you like, almost a delivery arm of the overall Greater Manchester programme around ageing. And I'm just seeing in the chat that Trafford and Stockport were excluded. And it took us a little bit of while to get the message out that it wasn't a decision by ourselves, the GM partners, it was a decision by the national charity, the big lottery and national organisations, because Trafford and Stockport were seen as being too well off. So that's where we got to. Now, in my mind, from the start, there were 2 challenges for this programme. certainly as I came into this when I was in GMCA, as it was then, this was before Andy Burnham became mayor. First of all, the first challenge was to make a difference to the lives of older people and to the communities that they live in. You know, and John and the team had done an amazing job to get 8 authorities agreeing to, I think it was a 10 and point whatever it was £1 million bid. Fantastic achievement. And then the second challenge for me was, how could we create sustainable change in terms of how public services and their partners thought about ageing? So those were the 2 kind of challenges for me throughout this program. And I don't need to go into detail about how many people have benefited, older people, and how many communities have been improved by this program, because you've already heard about some of that, and you'll no doubt hear about more about it. But there are 2 things I wanted to touch on really in terms of this this part of the discussion, and just to record them, I suppose, and repeat them. First of all, we created, or this program created, or maybe recreated, I think, a relationship between many of the organisations that had been involved in community development programs and initiatives and the ageing groups and institutions, because I think there'd been a gap between those 2 groups of people. So now in Cross GM, and you've already heard about some of them in the great film we just saw, there are far many more practitioners, people who know how to do this work in our neighbourhoods. You know, before this programme, it was a handful of people, if I'm being honest, outside of some of the mainstream charities. It's also helped to create and build an ecosystem across Greater Manchester, which I would argue is unique to GM. And Thea mentioned the weekly meetings that we have, where we have 25 or 30 organisations and agencies discussing everything from the nighttime economy to digital inclusion and all points in between. It's also been able to deliver this interplay of community action and research, which has always been part of my kind of approach to this work, right across public and community sectors. So that interplay between these different partners, all behind this idea of creating an age-friendly city region, I think has marked us out again as being unique in this country, certainly. And we've had all these wonderful events, you know, really moving testimony of older residents and their organisations across the whole programme. We've produced, and I said with Royal We, an amazing range of publications, which again is unrivaled in this programme. Probably critically, we've created, or I should say the older people in Greater Manchester have created a GM-wide network, which didn't exist before this work was done. And there are some things that are going to be happening soon around that I'll mention. And I think one of the most pleasing things, and there are a few colleagues who are involved in this programme that don't work in this area anymore, they've gone on to other roles. But colleagues who've worked in this area have been able to, and are being able to, take the learning from working in this way into new roles, not necessarily with older people or aging, but into other areas, different sectors working together, focus on placemaking and the leadership of older people. The second issue I just wanted to turn to briefly is, in some ways, the most difficult part of our work, is how do we mainstream the lessons that we've learned from this fantastic programme? How do we get commissioners, political leaders, senior managers, people who run voluntary sector organisations themselves, as somebody's put in chat, the new integrated care system, we have to land, we have to work to get those messages out into these places and spaces. I think at the heart of that, for me, is remaking the case for an age-friendly city region. We do know that too often older people's issues and ageing, huge, profound demographic change can be overlooked by leaders. And it seems to me that we have to restate that case for understanding the profound, as I said, change that's going on in our communities and region. We have to use the forthcoming Greater Manchester strategy and the work around inequalities from the Inequalities Commission and the Marmot report to restate the importance of investing in mid and later life. The other things that we're doing to mainstream this is that we will be relaunching the Ageing in Place programme, which kind of went on to onto a pause really during COVID from our perspective. And we're also going to be launching a new strategy document for the Ageing Hub at the June meeting of the Greater Manchester Reform Board. I think also the mainstreaming of the work is evident in how many of the projects have been supported and maintained at a local level. There are countless examples of that. And whilst I've already mentioned the Older People's Network, we now have the development of the Mayoral Advisory Panel on Older People, which is being led by colleagues at MAC who supported the Older People's Network joined up with ourselves. The last thing I just want to mention in terms of mainstreaming the lessons and taking action is that we're living or we're starting to live through a cost of living crisis, and this will impact most on older people who are on low incomes, from minority ethnic communities, people living alone, and from other marginalised groups. And we're going to be continuing the work that we did last year, the pension top-up campaign, and we're going to be launching a new round of activities from May onwards. So look out for that, sign up to get more information about that, because that's going to be our #1 campaign for the rest of the year. There are many other things we're doing as well, the digital inclusion work around older workers, and our housing and planning strategy. I'm going to shut up in a second. I just want to say something about the voluntary sector and then some closing comments. What I learned fairly quickly when I was in Manchester City Council on the Age Friendly Manchester programme and the Valued Older People programme is that if we wanted to get things done quickly and effectively in a way that meant things to people, particularly who lived in low-income communities, then we had to develop a relationship with the voluntary sector organisations, and we need to build up the voluntary sector organisations in those communities, particularly for older people, because often they're left out of some of those discussions. And it seems to me that what this programme has done, as I mentioned earlier, is recreate or help us build that infrastructure of knowledge and of people and of commitment and of passion. So if nothing else has been achieved, it's been that. Look, I think we should all give ourselves a pat on the back. Some people deserve slightly bigger pats on the backs than I do. John and his team have done a magnificent job. We should celebrate our achievements, and we should get ready for the next chapter, because there's lots of things for us to do. So let's enjoy today. Let's celebrate our successes, and then tomorrow morning, let's get going again. Thank you so much for inviting me to speak, and I look forward to meeting you all up soon. Thanks. Bye now.
Thanks so much, Paul. And yeah, absolutely second that about a pat on the back to everybody who's been involved. And yeah, there's some important work coming up with the Ageing Hub. And I think something that we're really lucky to be able to have with Ambition for Ageing is some funding to fund good practice mentors for the next 12 months. So from April this year to March next year. And, you know, the lottery are funding that. And it's going to give us time to be able to filter some more of our learning into Greater Manchester, and also bring learning from Ageing Better into Greater Manchester as well. So we're really lucky to have that opportunity. Right, okay, so we'll move on to the Older People's Network, one of their sections now. So we've got Elaine Unegbu, who's the chair of Greater Manchester Older People's Network, along with Dr. Emma Covenon, I think I'm pronouncing your name right, from Care and Repair. Elaine, over to you, please.
Thank you. Good afternoon, everyone, and it's indeed a pleasure to be here this afternoon. And I'd like to talk with you about the Greater Manchester Older People's Network and some of what we have achieved over the last 6 years. Greater Manchester Older People's Network was established in 2015 and as part of the Ambition for Aging program, and has grown, and we have almost 500 members from across Greater Manchester. Membership is open to anyone aged 50 and above, and to organizational representatives who work closely with older people. The most important thing to emphasize about the network is that it's about getting older people's voices heard. Our values are that we are led by older people. The network ensures that older people take a leading role in the network and shaping its directions and its priorities. Being age proud, the network celebrates aging and emphasizes the contributions that older people brings to our society. Being representative and inclusive, that is encouraging older people from across Greater Manchester, including the most marginalized, to be represented. The aims of our network: to make sure that decisions made and work undertaken across Greater Manchester take into account the values and priorities of older people. And it's also to promote the significance of older people as vital members of communities and society. To make sure that older people from every borough in Greater Manchester have a chance to have their voices heard and have an influence. We want to draw attention also to the diverse issues that affect older people within Greater Manchester, with particular focus on tackling social isolation and creating age-friendly neighborhoods. To work with a wide range of organizations, the statutory sector, local and Greater Manchester authorities, to make sure that we can influence policies and projects and services that affect us. To make sure that our network is inclusive and reflective of Greater Manchester diverse population and community. And we also want to promote the narrative about aging and encourage others to do the same. The network is led by a steering group made up of older people across Greater Manchester. The steering group meets once every 6 weeks to plan and guide the work of the network, to discuss emerging issues and initiatives, plan events and opportunities for the wider network, determine our priorities and focus, and is also a bridge between strategy and policymakers. From the recommendations of one of our early reports, and to help progress the work of the network, 3 working groups were established. We have the Health and Social Care Working Group, and that working group is chaired by Jill Stainthorpe, raising awareness for older people to get improved access to services. Transport Working Group, chaired by Colin Bailey. Transport is very vital, and even more so as the population ages. This service is crucial to enable us to contribute to society, and it also supports social contacts. The Housing Working Group is chaired by Julie Collins, people aspire to age well at home, and there needs to be impartial advice about housing tenures, access to trustworthy, reliable, affordable repairs, including access to the handy serviceman. The working groups meet every 2 months, and their aims are to ensure that issues remain on the agenda of the steering group. This is another way for members of the network to get their voices heard on issues that matters most to them. The working groups also allows us to develop relationships with partner organizations and raise our profile as a network. The network has collaborated in a range of campaign, research projects, and events to promote a more positive view of aging and take practical steps towards improvement. These include, we had an ageism campaign, and it was called Old Frame, New Picture, Challenging Ageism in All Its Forms. Digital Inclusion Network, as Paul has mentioned, helped to improve digital access for older people. And also we have the housing options research, which Emma will tell you a little bit more about. There's a series of videos that has been produced to let you know what an activist looks like. And working with Manchester University on research programs, giving older people the opportunity to input in research at all stages through to how findings are shared, but it is in a way that is accessible and meaningful. You know, and Thea has mentioned we have grown in confidence. Not only have we grown in confidence, we can also take ownership of what we have been involved in, and our voices contribute to whatever is decided, whatever research is decided. Finally, and the mental health campaign, we will hear something about that later. That campaign has been undertaken by the Greater Manchester Older People's Network. Finally, we will be working close with the Greater Manchester Older People's Equality Panel, which should be with us in April, and Paul briefly mentioned that. We hope to continue to increase our numbers, to improve our representation for all voices of older people in Greater Manchester. The journey has been amazing, but most of all, we look forward to making Greater Manchester a great place to grow older. Thank you.
Thank you, Elaine. So now we're over to Emma.
Great. Yes, can you hear me?
Emma, if you can keep it to 5 minutes, that would be fantastic. We are running over a bit.
Yep, that's fine. You can hear me okay, can you?
Yes,
yeah.
Thank you.
Right, good, great. Thanks for that, and great to be here today. So I'm going to tell you a little bit about the research project examining housing options information in Greater Manchester. And this project stems from the housing manifesto that the Older People's Network developed in 2017. One of the recommendations in it was that the older people need access to free, independent, and impartial advice about housing options. So based on that, this project was designed as a mystery shopping activity with the aim to assess the type of housing options information and advice that is available to older people in Greater Manchester over the phone. The project included members from the Older People's Network's Housing Working Group as co-researchers who were involved in each stage of the project and who did the research phone calls. They completed a total of 45 phone calls to the local authorities in Greater Manchester. Based on the findings from those calls, we are now working on the report and dissemination plan. The co-researchers will be involved in these as well, including opportunities to share findings at policy meetings. What's important and special about this project is indeed, like Elaine mentioned, is the voices of older people are heard, and this has been led by older people. They've been involved in the project design. They were the ones who did the actual phone calls to the local authorities. and spoke to the local authorities to get, and in many cases, they did not get the advice we were looking for. Having the co-researchers involved in each aspect of the project has been really invaluable. And then lastly, I will keep this very short. We asked the co-researchers what the experience was like for them. One described that this was a good way to find out what is not working. Another one told that they now know more about housing options and where to access the information that they could use for themselves in the future or to give as advice to others. And another co-researcher described the sense of satisfaction of being involved in an important piece of research that has the potential to make changes. We'll be publishing the findings in the next month or so, so we'll be sharing those across the different forums. Thank you.
Thank you, Emma. That is a really important piece of research. I think that you know, when you work in the health and social care system, or you know, within any kind of council services, it's easy to feel like pathways to information are quite straightforward, but actually when you're not used to that, it can be really difficult. So anything that can make those more accessible is you know, really worthwhile. Thank you. So we'll have another section from the Older People's Network after the break. So now we're going to have Claire Bonetree, who is Project Officer at GMCVO, and she'll be joined by Laurie Roberts as well from LGBT Foundation to talk about some of the work that we've done to support marginalised groups across Greater Manchester and our equalities work. Over to you, Claire.
Thanks, Thea. So I've got a few slides for this. And some of you might have seen, I wrote in the chat there, I'm Claire Bonetree. I've been working on equalities, diversity and inclusion within Ambition for Ageing since 2018. And so I'm going to talk a bit about what I think has been one of the big successes of the programme, and that is the way that consistently throughout the programme, Ambition for Ageing has listened to, learned from and supported marginalised and minority communities, not always the same thing, to raise their voices around ageing and inequality. And in the process, we've gained new knowledge, we've contributed to a growing evidence base around ageing and inequality, and we've revealed areas for further investigation and support. And by we, I do mean we, workers, staff, project officers and older people working together in different ways at different times across the programme. So I'll just say a little bit about that as I go along. As Thea alluded to or referred to right at the beginning, the programme's based around, very much based around understanding that inequalities are intensified in ageing. Economic inequality before retirement can mean that some older people start the lowest earning portion of their lives closer to poverty. Systemic racial inequality and other forms of systemic inequalities mean that older people from different communities are more likely to start ageing on lower incomes than others, in poor health, inappropriate housing and so on. And similarly, people are more likely to experience social isolation in later life, not only because of the life changes that ageing brings and that make us more vulnerable, such as being widowed, having to move in older age, but also because of social barriers and structural inequalities I've just mentioned. And of course, those differences and inequalities also show up again within marginalised communities or minority communities as identities and social barriers intersect and cross over to exclude some people further. So for example, older LGBTQI plus people of colour, older South Asian women and so on can often experience more intense kind of social isolation or at higher risk. And so understanding all of that, equalities and an understanding of inequality was embedded in the design of Ambition for Ageing, as Thea was saying early on. And that commitment to equalities work, to an understanding inequality, was right in there in the strategic principles underpinning the design of the programme. There's a bit of a quote there from our strategic document. And there were some aims and objectives of that: providing a voice for older people at particular risk of marginalisation, discrimination, ensuring older people from all communities and all abilities could get involved in and benefit from the programme, and developing connections with equalities organisations across Greater Manchester. And that's really important because, like Paul McGarry was saying, working in partnership has actually been really core to the success of the programme. But I want to say as well, other people have referred to the Equalities Board, that it's really important that in Ambition for Ageing, equalities was never, a commitment to equalities was never purely theoretical, and it wasn't just an idea, it was real all the way through. For example, the Equalities Board was established through a process of co-production in 2016. And then throughout the programme, it meant that older people with lived experience of marginalisation, discrimination and so on, and equalities organisations within Greater Manchester were had a voice within the programme. So this test and learn structure and the test and learn process of the programme as a whole meant that the learning from those people and from the work that the Equalities Board did kept being fed back into the design of the programme on an ongoing basis, through regular reporting, through internal structures and so on. And Yasmin, in that short video, Yasmin from Buzz, talked about one of the key things that we produced from our research, which was this spatial model. So together, the Equalities Board staff and members learned from the delivery work that was going on in local authority areas with older people and multi-sector organisations. And we learned a lot about kind of the diversity of ways of working with different older people and with different communities within local areas and so on. And one thing that we learned from looking at that community development work and the projects that were led by and designed by older people was that successful ways of working with marginalised communities were linked to the size and distribution of that community. So that's what this little diagram here is, the sort of the black kind of X there in the middle. We found that by mapping the relative size, so the comparative size of different communities from small to large, and their relative distribution from more concentrated to more dispersed across an area of different marginalised communities within an area, you could work out what kinds of community development work might be most likely to reach and include different groups of people. So we produced a guide, which Yasmin referred to, and the links on here, don't worry about getting them down because we'll send the slides out after this and you can click on them when you get them. And that's an example of the kind of sort of learning that we did by looking at the work that was going on in delivery areas. And one thing that we learned from this, what we call the spatial model, was that it helped us understand that smaller communities of identity or experience whose members don't live near each other, what we came to call dispersed communities, might need to be supported in different ways. So remember that, dispersed communities, I'm going to come back to them in a bit. We also commissioned and supported new research by community organisations and grassroots organisations. And you might remember Moaz from that little video earlier, and Moaz talking about the piece of research that his organisation undertook. And that was one of the pieces of research in this Ageing Equally programme. So we learned early on from some projects by some of the members of the Equalities Board that sometimes community organisations are best placed to know what questions you ask to uncover the hidden needs in their communities. So, you know, you don't know what you don't know, but sometimes you kind of do know how to find out what you don't know if that's happening in your community. And that was what we learned. So Ambition for Ageing then developed this, one of its scaled programs was the Ageing Equally program, which had pots of money to commission research by community organisations into what makes a good place to grow older for people in minority communities. And there was a real range of organisations that participated, contributing research into the needs and experiences of really diverse older people from a wide range of small language communities, ethnic minority communities, and a variety of disability and health-related experience communities as well. And we found that older people in minority communities often have the same understanding of what it means to age well as other community members, which is not a surprise probably. But we also found out that they often experience their neighbourhoods differently, and they have different relationships to places and the communities in the places where they live. And these are often related to exclusion, and that needs to be understood. For example, they might face language and other barriers such as inaccessible transport. They're more likely to face isolation due to their distance from other community members, other people like them, or members of their own kind of community of identity. And also, they sadly often also experience inequality and direct discrimination. So we wanted to understand a bit more about these communities, and that has led us now in this last year of Ambition for Ageing to focus on what we call dispersed communities. So these communities, which we define as a group of people who share an identity or experience, do not live all near each other in one area, so they have to travel away from their neighbourhood to meet up, buy the food they prefer, get the support they need, practice their faith together. So that's not only small ethnic minority communities, but also, for example, deaf BSL community is widely dispersed. Carers can be identified as a community of experience, widely dispersed, not all in one area, may have only one place to go and meet, so they have to travel away to get there. Those sorts of communities. And the Ageing Equally research had produced some valuable insights into characteristics of these communities. For example, travel is integral to remaining connected, obviously, and meeting even daily needs such as food buying, and also that members are more likely to seek support from their own community organisations. And then there was research done during the pandemic, which in the chat you might have seen Sarah and Jason mentioning that, the Pandemic Pressures Report, and then other organisations such as Runnymede Trust, Bailey and others did some research that found some of these sorts of organisations were providing really specialist support to community members who were not able to get it from other places. But they had such low capacity and funding support for themselves, they were under a great deal of pressure. So we've just undertaken a project to support and find out more about these organisations and the way they work with older people in dispersed communities and the ways that they do non-place-based work. And we hope to find out more about them. For example, we found that they mitigate for geographic dispersion, for the kind of, you know, they make up for the fact that communities are spread widely in the way that they work. They help people in those communities to use mainstream services, even though they don't necessarily provide specialist services of their own. Their specialism is in helping people access the mainstream. And they provide really the important kind of age-friendly infrastructure for minority communities. But we're going to, sorry, before I get on to the end, we're going to talk more about that in a seminar on the 23rd of March. So I really urge you to look out for that and book a place on it, because it's also a chance to hear from Laurie at the LGBT Foundation, who's also been running a dispersed communities project from the LGBT Foundation as part of Pride in Ageing. Laurie, can you tell us a bit more about that? Because you'll be coming to the seminar on the 23rd of March as well.
Yes, absolutely. Thanks, Claire. So LGBT Foundation, we've been honoured to be a partner organisation with Ambition for Ageing, hosting the Equalities Board. But as Claire mentioned, we've recently had funding under the Ageing Equally strand to run some events as part of our Pride in Ageing programme, which is around the needs of our over 50s LGBT communities in Greater Manchester. And I guess I'd say that Ambition for Ageing, the approach that they've taken, the consideration of intersectionality and voice, as LGBT Foundation, we've always been able to see our work reflected in the work of Ambition for Ageing. And I think the spatial model that was introduced by Claire just now was a real breakthrough moment in seeing sort of how challenging work is with dispersed communities, and it may require this kind of different approach. So I think you know, the consideration of working with marginalised communities has been a strong point of Ambition for Ageing, ensuring that there's not just one way of doing things. So place-based working might work for the majority of people, but there may be another way as well. So really, you know, it's been great to be part of this project. And you can hear more about the specific project work that was produced by LGBT Foundation under the Ageing Equally strand on the event on the 23rd of March.
Thank you both, Laurie and Claire. So right, we're gonna have a break now, and we're 5 minutes behind. So we will come back at 2:41. That's 5 minutes, and we will just have to get started. So, if you do need to take a little bit longer, then you know, we will start at exactly 2:41. See you all in 5.
Hi Thea, I hope it's okay that I've got my first slide up.
Absolutely, that's perfect. Well, it's just gone to 2:41, so we'll get started. So we'll keep to time, as I said.
Yeah, thank you.
So welcome back. Hopefully everybody's back with us, or if you're not, you won't hear that, but you'll be joining us soon. So yeah, now we've got another section from the Greater Manchester Older People's Network, and we're joined by Adele Owen from the Health and Social Care Partnership, Polly Kaiser from NHS, and Gillian Stainthorpe from the Older People's Network to launch the new campaign, which is on a serious note, and it's about older people and mental health. Over to you, Adele. Thank you.
Oh, thank you very much, and thank you very much for inviting us today. We are using this opportunity to launch this campaign, so we're really excited about it. We've been working on it probably for the past year with the Older People's Network. So just to start off with, Polly, are you there?
Yeah, I'm here. I'm here, but can you see me?
Can you see the slides?
I can see the slides, yeah.
Right.
So just, it is on a slightly more serious topic of mental health and self-harm, and we just ask participants here to think about their own self-care needs and be mindful of that.
Thank you.
Now, one of the things is that there are a lot of myths around self-harm, not least of which that it's only teenage girls who self-harm. I'll let people read these quickly, but you know, it's a cry for help, it's manipulation, it's always for attention, it isn't treatable. And these are obvious myths. There's lots of different definitions of self-harm, and it's defined in the National Institute of Clinical Excellence guidance as any act of self-poisoning or self-injury carried out by a person, irrespective of motivation. And that can include indirect self-harm, such as refusal to eat or drink, and self-neglect, to more active self-harm and possibly suicide. Self-harm is a major risk for suicide, and we had lots of conversations in the working group about the indirect self-harm as well. But it's a way of coping with unbearable feelings. That was the take-home message. So the NICE guidance says that all people over 65 and over who self-harm should be assessed by mental health professionals experienced in the assessment of older people who self-harm, and it should follow the same principles as working age, but in particular for older people we need to note the presence of depression, possibly cognitive impairment, early signs of dementia, mild cognitive impairment, and in particular physical ill health, and include assessment of person's social home and situation, including the role they have as carers. And we've heard a lot about the importance of carers and the intersectionality around poverty and health today. It also needs to take into account the high risk of suicide following self-harm. So one of the facts, even though I've worked in mental health a long time, the research done by colleagues at Manchester University, Professor Nav Kapoor, found that older people who self-harm are 67 times at greater risk of suicide than other older people, and 3 times at greater risk than the relative risk of suicide than younger people. And this was quite a shocking statistic, even for myself, and I think that's when Adele and I first met, when we had these conversations. So there's an elevated risk of suicide in older people, but shockingly only 12% are ever referred on to mental health services within 12 months. And referrals are a third less likely for older people in the most deprived areas, again, linking in with the intersectionality and equality issues already raised. And 1 in 7 older people self-harm again within a year of the initial episode. So pre-COVID risk factors for older people for self-harm included bereavement, loneliness, isolation, physical health, and especially pain, and stigma and feeling a burden. And I think we all know from our conversations over the last 2 years that some of these issues have only increased for many older people, despite all the positive work that goes on.
Well, thank you, Polly. I realised I never really introduced myself at the beginning, so and I never gave you the opportunity to either. So I do work for the Health and Social Care Partnership. I'm a suicide prevention programme manager, but I also oversee the bereavement support as well that we have across Greater Manchester. So our Greater Manchester Suicide Prevention Programme Board, having seen those statistics that Polly just shared, decided that self-harm in older people was to be a priority of our programme, and this was last year. You know, we hear a lot about young people and self-harm, but we really felt we needed to give a focus to older people. So we do have the Shining Light on Suicide campaign and website. So kind of building on that, we decided to commission the Older People's Network in Greater Manchester to help us kind of co-produce an awareness campaign about older people and self-harm. So I'm not going to play the YouTube clip now, and if you do access the slides later, please do, but you'll hear Professor Nav Kapoor talk a little more about older people and self-harm and then the risks of suicide. But you can see his quote there that, you know, we sometimes think of self-harm as a problem in young people, and of course it is, but it affects older adults too. And the concerning issue is the link with increased risk of suicide. Older people might be particularly vulnerable as they are uniquely exposed to issues such as bereavement, isolation, and physical as well as mental illness. So Jill, it's been a real honour to work with Jill, who I think should be in the meeting now as well. So working with the Greater Manchester Older People Network with Liz Jones and Jill, has made this whole campaign building a real joy. Gillian, is she with us?
Jill,
she was having IT issues earlier.
Yeah, can you hear me?
Oh yes, we can hear you, brilliant.
Good, excellent. Okay. Good afternoon, everybody. I'm a member of the Greater Manchester Older People Network Steering Group. And as you heard earlier from Elaine, the network is underpinned by a set of core values that older people themselves decided should be reflected in all the work that the network undertook. Chief among these is the passionately held belief that older people should articulate the voice of older people through their lived experience, and that this will be achieved by being age proud and involved in what matters to them. Okay. Next one. It was with these values providing a backdrop that the GMOPN Health and Social Care Working Group, which I chair, began to talk about older people's mental health. Disturbing reports in the press had begun to highlight the increase in older people's mental health through the COVID pandemic, largely due to isolation and loneliness. Almost simultaneously, Adele and Polly were expressing similar concerns, including rises in self-harm and suicide through the ageing home. It was agreed by the working group that it would be good if we approached them to see if we could work together on a campaign that would raise awareness for both older people and their families and or carers. Adele and Polly attended a working group meeting and gave their professional perspectives, and from all these fortuitous interactions, our wonderful collaboration began. The GMOPN working group and the wider network had done some scoping work to see just what was out there across Greater Manchester for older people experiencing mental health issues. And guess what? There was very little visibility of advice and guidance for older people, and certainly nothing that invited closer attention. This situation had to be something we could address through a co-production campaign, and something we all felt was worth pursuing. From the beginning, we worked as equal partners, each bringing their own expertise to our regular meetings. We fell into a largely informal way of working, and the meetings became, well, organic, allowing us all to become more creative in our thinking. One of the inspired creative moves was to employ Tom, an artist with a talent for catching the gist of discussion in cartoon form. Tom attended our first focus group meeting and produced a number of sketches which certainly appealed to the attendees. The group held on Zoom was positive about the proposed campaign and confirmed many of the thoughts iterated about how we approach such a difficult subject. A second focus group was held once we had firmed up some ideas, but whilst there was still the possibility of alteration if the designs and messages didn't meet approval. The focus group fully endorsed the approach taken and felt the posters would appeal to older people. The feedback from both focus groups has been overwhelmingly positive and affirming, and older people have been involved at all the stages of development. So, has co-production been valuable? I would give a resounding yes. The process itself has raised awareness, not just with older people, but also with other organisations and professionals. We know that our campaign has an older people seal of approval and has the appeal that we needed. There is a definite sense of ownership, which will help with distribution, and we have all learned from each other in the process. It's been an absolute joy and privilege to work with these two consummate professionals. Thank you for listening to me. Thanks.
Thank you, Jill. Thank you. So this is the main poster that was agreed upon by the focus group. And it came out in discussion about phrases that are familiar to many people. So not brushing things under the carpet. And with Tom, the cartoonist skills, his kind of imagery kind of inspired us really to take this path in how we want to raise awareness. We were really conscious that talking about self-harm and suicide it's a really sensitive area. So it's quite subtle, but we've kind of chosen some of the issues that we referred to earlier that we know can cause people to feel, they have challenges with their mental health. And we have included the terminology of self-harm in there. It was asked for that we had a QR code, and not everybody would want to use that, but there will be some who will, or family members or professionals who may use it to take them to the relevant page that we've added to our Shining a Light on Suicide website. We want to encourage people who may be struggling to talk to someone they trust. But at the same time, we know that for many people, it is hard to reach out when you are struggling. So we really want others to actually reach in as well. That's professionals and carers and family members. We have got some social media assets. So these will be shared through Twitter, probably Instagram and other avenues. And we would encourage anybody to share these. We have shared a communications pack with all the different communications teams across the city region. And we also have a GIF, so one of those moving images, which we haven't got in this presentation, but hopefully you will see it soon. So that was a really fast run through, but I want to say a massive thank you to all those people that did attend the two focus groups. And they really helped us shape a campaign which we're really glad to be running. Thank you so much to Jill, who's attended all the meetings and the working groups, and also to Liz, who isn't with us today, but has been overseeing things from the GM Older People Network as well. Polly, did you have any last words you wanted to share?
Just to say a huge thanks as well to Elaine and all of the people that contributed, like you've said, and also to say that this is really an acorn in terms of raising awareness of mental health. And I put in the chat that we're hoping to build on this acorn in terms of working with MAC to support the voice of older people, but around mental health and linking with the equalities aspect. So a lot of the people who've spoken today, I can see the kind of cross-sectionality there. So please watch this space, and we'll be working with you.
You've just reminded me that Polly and I have been talking about, obviously we need to reach the professionals as well. When people reach out for support, we want to make sure that they get a positive reaction, and they're not going to be one of those percents that aren't referred on to people that can help them. So we've got plans underway, and we're really grateful for the National Confidential Inquiry Centre for Suicide and Mental Health, which is based at the University of Manchester. Ali Bird was part of our working group, and they are putting together some infographics just to highlight, to raise more awareness about self-harm and older people. So they should be ready in about 6 weeks, and again we'll share those. It's quite a kind of a quick and an easier way to try and get across the key messages for us. So thank you very much for allowing us the opportunity to kind of launch our campaign here at your celebration event.
Thank you. Yeah, thank you to Adele, Gillian and Polly there. And of course, Liz Jones, who has facilitated and supported the Older People's Network, can't be here today, but a huge thank you to Liz. It shows that the Older People's Network aren't afraid of tackling really important and difficult topics like this. So yeah, thank you all. And we just want to also, it's the first showing of a video from a different campaign from the Greater Manchester Older People's Network. You may have seen there I'm an activist campaign that was previously released, and this one is focused on Tameside, looking at some intergenerational work and people doing things in their communities. So we'll just play this short video.
It's me and me.
It's me.
And me. It's me.
I'm me.
It's me.
And me.
You can make a difference in Tameside.
No matter what age you are.
That's great, thank you. So that was made with obviously Greater Manchester Older People's Network and Yellow Jigsaw, and talking about my generation, and we are looking forward to some more videos as well in the near future. So now, Mary, if you can share the slides again, please. Throughout Ambition for Ageing, we wanted to know what is it in Greater Manchester that makes age-friendly places, and the analysts at Greater Manchester Combined Authority looked at 3,000 responses from Greater Manchester residents that we'd collected to build up that picture, and we found that a lot of the things that people needed to make an age-friendly place were very similar to the World Health Organization's criteria too. So with people, as it says on the slide, community integration and belonging, participation opportunities, transport and accessibility, feelings of safety, and information and communication about what's happening. I think that's something that we found throughout the programme, that something as simple as a what's on guide going through someone's door can make a huge impact, and people might hold on to it for months, but then finally go along to something. And one of the really important parts was social infrastructure, so those places for people to meet, and the importance of having those in the community so that people can connect. So Sophie, over to you to talk about her research on social infrastructure.
Thank you very much, Thea. Thank you so much for inviting me to this event. I'm delighted to be here. I was one of the research fellows who worked on the project, and as Thea's already said, most of my work was looking on the role of social infrastructure. So I'm just going to use the opportunity today to reflect a bit on the role of social infrastructure in creating age-friendly communities, but also to say a bit about what I think Ambition for Ageing has brought to those discussions and debates on social infrastructure, which I think is an important legacy of the project. So social capital, or the kind of different relationships and connections and networks that people have, has long been quite a prominent concept in the literature on older people and age-friendly communities. So we know that social isolation can be tackled through people building connections where they live. And we also know, we've already heard through the Ambition for Ageing programme, that the environment in which we age is hugely important as well, hence the place-based approach for a lot of Ambition for Ageing's work that they've done. And we've also seen kind of some of the World Health Organization domains on age-friendly communities and cities. They've identified outdoor spaces, buildings, and social participation. So we know that these things are really important in creating age-friendly communities. However, I think what was less prevalent in the research and what was less well understood is the different spaces in our communities that allow social life to flourish and allow age-friendly places to be created. And so the Ambition for Ageing obviously was all about kind of creating and providing opportunities for older people to have social interactions and to build social connections in their neighbourhoods. And the programme discovered quite early on, I think, that the role of social infrastructure, or the spaces and places where we have interactions and connections, were hugely important and vital to this work. So the existing research, the existing academic and grey research around this, tells us that social connections are really important for older people, and we also know that older people tend to spend longer or more time in their neighbourhoods than other age groups. So Ambition for Ageing started to dig a little bit deeper into this relationship between social connections and neighbourhood spaces to see if we could identify what types of spaces and places were helpful in supporting what different types of social connections. And this is where I started doing a literature review, so looking at existing academic literature, so looking at what previous research studies had already said around older people's social infrastructure and social capital. And the findings from this literature review were produced in a report which is available on the Ambition for Ageing website, Social Infrastructure, How Shared Spaces Make Communities Work. And what I found kind of doing this review of the existing literature was that some spaces are really good for bringing people together around a shared interest or shared activity or shared identity. So these spaces are really good and really helpful at creating what we call bonding social capital. Other spaces are particularly good at creating what we call bridging social capital, which is when we bring together people of different backgrounds or different experiences, people who maybe wouldn't usually come into contact with each other during the course of their day-to-day life. What we also found was the importance of spaces that allow for weak connections or weak ties to build up over time. And I'll say a little bit more about that in a second. So what we found doing the review of existing literature seemed to challenge some of the kind of predominant thinking around social connections and older people and age-friendly communities. So for example, a lot of the literature around volunteering really highlights making friends and making new connections through volunteering in later life. And whilst this continues to be hugely important, and I wouldn't want people to think it isn't, I think we also need to really value and not to overlook weak ties of connection. So by weak ties, we mean people who maybe know each other's names, they might be acquaintances, but they don't have any kind of strong bond of friendship. They don't have any obligation or responsibility to those friendships. So what we found was being in a shared space is just as important about being seen and seeing other people as it is having in-depth conversations. And we need both different types of social connections to create age-friendly places. We need both weak ties and strong ties, and we need to have connections with people who we have similarities with. We also need to have connections with people outside our social circles. And I think the different types of social connections that we have maybe became increasingly apparent to us during the pandemic, when we started to notice how our networks were quite different, and notice how we missed different types of networks that we may have been a part of. So the conclusion of the report for Ambition for Ageing on social infrastructure was that we need a diversity, or maybe an ecosystem of social infrastructure to help create age-friendly places. So we need places like community centres, libraries, leisure clubs, religious organisations. We need these types of spaces that can create organised activity that bring people together, that have something in common, giving people the opportunity to develop strong bonds and bonding capital that may provide the basis of strong friendships. But we also really importantly need these spaces to work with an equalities mindset, and we've already heard about some of the really important equalities work Ambition for Ageing has done. We need these spaces to work with an equalities mindset to ensure that these places do remain open and inclusive to a diversity of users. This will open up the possibility of those spaces bringing in people from different backgrounds and creating spaces where people can connect with people from other networks outside themselves and create that important bridging capital. And I think, again, thinking about spaces that bring people together, we can also think about the importance of parks and green places that are open to all different types of people, and crucially at different times of day and for different uses. But then we also need to think about other types of social infrastructure, the types of spaces that support the development of these weaker, kind of more ephemeral acquaintanceship type of social ties, the weak ties that are also so important. So these are spaces where we have kind of maybe passing or fleeting, sometimes often even non-verbal interactions with others. These are the spaces in our neighbourhoods where we can feel part of the community, even if we don't particularly interact with people. We see other people and we are seen by others, which is hugely important in creating age-friendly spaces. These are sometimes the most kind of overlooked parts of our social infrastructure, sometimes the less glamorous parts of our social infrastructure. So we're talking about places like banks, public transport, post offices, shops, restaurants, coffee shops, spaces that might not be designed for social interaction, but nonetheless are really important spaces where social interaction occurs. And sometimes with people experiencing social isolation might be the only spaces where they have interactions on a daily basis. So the findings of this report was kind of expanded, and it was published in a book by Emerald Publishers called Creating Spaces for an Aging Society, the Role of Critical Social Infrastructure. I just want to kind of end by kind of summing up some kind of key reflections, and I think how Ambition for Ageing has really kind of developed the understanding of age-friendly communities and the understanding of where older people have interactions and the importance of social infrastructure. I think firstly, the role of inequalities or equalities has been really centred by Ambition for Ageing. And when we think about equalities in the context of social infrastructure, we start to see that there's a geographic unevenness to social infrastructure. Some neighbourhoods simply have better and more accessible social infrastructure than other places. Some places have seen the closure of their libraries, their kind of high streets have become run down. They don't have access to parks and other green spaces, where other neighbourhoods are much kind of better resourced in these things. So this creates a barrier, I think, to doing age-friendly work when we don't have existing social infrastructure. So not all neighbourhoods are starting on an equal playing field when doing age-friendly work. I think that's been a huge, important finding for Ambition for Ageing. Also recognising the needs of different groups of older people, specifically minority communities who are not geographically concentrated, as Claire's already mentioned. So looking at the needs of different groups and how different groups of older people have different needs in terms of their infrastructure and different kind of spaces that they will have social interactions in. So the diversity of social infrastructure required to do age-friendly work is really important. And I think Ambition for Aging has helped kind of broaden the conversation out from thinking just around community centres and organised activity to also include these kind of other everyday, more kind of mundane or passing spaces that we might think of, the spaces that we need to kind of connect people before we can maybe do more kind of engaged work. And I think linked to this, Ambition for Aging has also highlighted the different forms of social connection, or the different forms of social capital that are required to create age-friendly communities. So we need strong ties of friendship and kind of more deeper connections. We also really need to emphasize the importance of these weak ties, which are kind of just passing people in the street. Being familiar, or being a familiar face in your community, can be just as valuable as having a really in-depth conversation with someone. And I think just thinking a little bit about the legacy of Ambition for Aging, maybe looking forward as we kind of build on from the programme, particularly in a kind of post-COVID era, and building a post-COVID recovery. I think, again, kind of centering the role of inequalities is something that's particularly important around this. I think I've spoken before about looking at other crises or other disasters that communities or kind of societies have emerged from, and thinking about the importance of rebuilding infrastructure, so rebuilding roads, rebuilding power plants, etc. And I think the COVID-19 crisis requires just the same approach in kind of rebuilding our social infrastructure and making sure that we invest in the spaces and places where people, and older people particularly, can have social connections, and making sure that those spaces maintain their age-friendly principles as we kind of build out of a post-COVID-19 context. So thank you very much again for inviting me to speak today, and I hope that's been helpful.
Thank you, Sophie. Yes, and really important how things have changed since COVID-19, and people's fears about going back in using different types of social infrastructure. So now, over to Luciana, who has been compiling a picture by doing a process evaluation on our recent Supporting Aging in Place funding. And here's just a short snippet of some of the findings, but again, we have a full seminar on the what date is the seminar, Lucy? The 9th of March, so please book onto that. Luciana, over to you. Thank you.
Okay, well, thank you very much. Can everyone hear me? Yeah, good. So I'm going to keep my talk really brief, not least because we are quite late and we still want to hear from you. And there's going to be this presentation of the findings of the report on the 9th of March. So please book yourselves in, because it would be great to see some of you. And I'm going to save all my thank yous for the 9th of March, because there's plenty of people that are here today that I would like to thank for contributing to this research. So, so I was a research associate, or I am still a research associate with MICRA, my job was to do the evaluation of Ambition for Aging in this year 7, in particular of the Supporting Aging in Place. So in terms of the methods I used, I'm an anthropologist. So for those who are not familiar with what an anthropologist does, so basically we look at communities and we try to sort of live with and do things with communities. So for me, it was an absolute privilege to do this work with Ambition for Aging, because it's all about community making. And what I saw in this evaluation of the work is that Ambition for Aging enabled communities to enhance their sense of belonging and their possibilities of making community. And there's lots of amazing findings, but I think for me, one of the most striking ones was the protagonist role of older people in being like project leaders and in taking those projects forward. It's been like, you know, an amazing discovery of all this that is going on in Greater Manchester. Absolutely amazing work. So in terms of the ethos that Ambition for Aging works with, this test and learn ethos, I thought this was also very well accomplished by the team. And through the years, through the 7 years of Ambition for Aging, it's been, Claire has already mentioned this, how this learning has been constantly being sort of, you don't just produce the findings, but you kind of feed that into the new project. And as I evaluated the process, the year 7 process, I saw exactly this learning that happened over the years of Ambition for Aging being constantly reflected on and improved the process as it went along. So if we could move the next slide, please, Mary. So I have here just very quick snippets of some of the projects that I visited in Greater Manchester, and the kind of things that I learned with the communities about their work, these amazing activities on social infrastructure, which Sophie has already talked about, gave you a great presentation about what is social infrastructure and how important social infrastructure is for community activities. The importance of networking, which I'm going to be talking a lot more about when I come to present the findings of the report. Next slide, please, Mary. And then I think also, and I must praise here the fact that the research component of Ambition for Aging is very much interdisciplinary, because the members of staff are from different backgrounds, and of course the people that you meet in the community projects are from all kinds of backgrounds. So this is sort of proved very fruitful in terms of findings. And I have here in this slide just a short list of findings by participants. So this is all things that participants told us, or me as a researcher, about ways that they could, that the process could be made better when organizations are funding community projects, but also how policymakers could take these insights from community members and project leaders on board to make their communities better. Next slide, please, Mary. So here another 2 projects, so Ride a Brow and Walk and Talk. I'm an anthropologist of green spaces, so I'm very interested in people's relationship to green spaces. And these are just 2 examples of that. And again, something very important and a very relevant finding of the evaluation is the importance of social prescribing in terms of reaching out to more marginalized members of the community who perhaps are not engaging with the community activities. And also the value of green social prescribing, which for me was something actually quite, as a researcher, something new and very valuable in terms of findings. So this idea that sometimes people don't know that they would benefit from being outdoors or doing some planting in the allotment, or perhaps, you know, engaging with an art activity in nature. So there is something that is now called green social prescribing, which is about bringing community members into art work that relates to nature. And then a final point that I want to make with the last slide is just the joy of finding how these community projects that Ambition for Aging funded can change people's lives and can really make a difference. And this was just another project in Trafford about these women who, South Asian women, who they learned to ride a bike. And this, yeah, I just wanted to finish on that note. And thank you very much for inviting me here today and for letting me be part of this project, amazing process. And I talk more about it on the 9th of March. Thank you.
Thank you, Luciana. And yeah, we're really looking forward to that seminar next week. So we've made the decision to, we're not going to have the breakout rooms because we are running late, but the Ambition for Aging team will wait at the end of the event if anybody does want to speak or have a conversation. So I'm going to hand over to John Hannon, who is now GMCVO's Chief Executive and was previously the Programme Manager of Ambition for Ageing, for his reflections on the programme. Thanks, John.
Thanks, Sarah. I think it's my job to try and bring it all to a kind of neat end, and I'll do my best there. And yeah, I've not been working on Ambition for Ageing for about 6 months or so now, and I've got a couple of insights there from that. The first is, I think it got better once I left, which is something for me to think about. But I think also what I think is really important is I can come to this meeting saying, thank you all. You are Ambition for Ageing, even if this is the first event you've attended, because it was more of a kind of concept and an idea and a dream, I think, at the start of it. And we've produced some fantastic reports, some fantastic tools, some really great evidence. Sophie even wrote a book about shared spaces, although I'll not give away the ending of that. And so there's a lot of really good written stuff and written research stuff. But at the end of the day, our legacy is in the people. Our legacy is in the networks we've created, the projects we've created, the friendships we've created, all those connections that have been made. The whole point of the programme was to try and reduce isolation, and that can only happen through increased connections. And so the people are always going to be the legacy of a programme like this. And I just think back to when we wrote the bid, and Paul mentioned he was involved even before the bid, that an opportunity bid was a thing. But when we wrote that bid, the first sentence was, we believe that the ageing population of Greater Manchester is an opportunity. And that's only true if we believe it, and if we continue to believe it. And there's still an ambition for ageing that we can have. And actually thinking back to those early days, when we got going, one of the first community projects we developed, I was kind of disappointed with it until I started to talk to one of the colleagues that developed it. And it was running a fun day in a care home. And it was just like, I was hoping for some really experimental stuff, to try and push the boundaries. But speaking to the local colleague who was working with it, there was a resident of this care home who was in her 80s. She just lost her son, and she outlived all her family, and she was alone. And what the project did was give her a chance to create a fun event and an activity in the place where she lived. And she was speaking to the worker and saying, I've never done this before. And not in a sense of nervousness or kind of trepidation, but with excitement and anticipation, and the ability to do another of these events and do more of these events and make those connections with fellow residents. And it's just, I suppose, here sat at the end of things after 7 years of delivering and work, no matter how old we are, no matter how we got here, no matter how long it took us to get here, our lives are in front of us. Our opportunities are in front of us. And if we have ambition, we have proven time and time again, there's so much more we can do to build connections in place and build connections with each other. So I'll just finish on that point. Thank you for everybody who's worked on this programme, whether a volunteer, whether it's one of our team, people who've come to join us, people we borrowed for a while and moved on to other projects. But it's such a delight and a joy to see from a bid that went in how much change we've created, even considering the difficult operating environment at the moment. It's just such a delight, and it's great to be here. Thank you.
Thank you, John. So yeah, after I just want to say a few thank yous as well to staff and colleagues who've worked on the project. And then looking through the screens now, I can see some people that have volunteered on the panels. So thank you to everybody who's given their time to Ambition for Ageing. So as I said, if anybody, we didn't do the breakout rooms because we were running really far behind. So the Ambition for Ageing team will hang on now if anybody does want to have a chat about anything. But other than that, thank you. And we've actually managed to finish at 5 minutes early now. But thank you to all the speakers who've come along today as well. And we hope to see you. What we'll do next is to send out an email with some of the reports on, but more importantly, the links to book onto the seminars. One about the dispersed communities research work, which is going to be on the 23rd of March. And then the other one, Luciana, for the process evaluation, which is next week. So please do book onto those. And thanks for everybody for coming today.